So as far as the skill set of the doctors go, it ranges between surgical skills and basically skills of the pulmonologist. These skills, they are the pinnacles of care in our profession. So if I talk about pulmonology, it entails three basic pillars. One is basic general pulmonology, which means interpreting the disease and timing the organ donation and the recipient at the right time. Second is critical care of the highest degree, because these patients are extremely critical when they get operated, and you have to have that kind of care along with infection control backup to get these patients to survive. And three is interventional pulmonology skills, because these patients will have lungs which are fragile, which will have to be assessed from time to time, and every intervention can lead to infection. And if you encounter a challenge or a problem or a complication, all that needs to be treated with intervention procedures, and that skill is not very well available across the country. So for us to even think of a lung transplant program, we as doctors have to have that kind of skill set, confidence in ourselves that we'll be able to perform this surgery without any hassle. And last but not the least, convincing a patient to undergo a transplant at a hospital which is doing it for the first time, there are bound to be teething troubles. And the patient has to have that faith in our team, as well as we have to have faith in ourselves before we can sort of venture forward in such a major challenging transplant program. So luckily for us, we committed around 6 months back that we'll do the transplant. We got the permission on 18th of January to start a registry, and we did our first transplant on 18th of March. 6 months is, I would believe, a very short span of time to sort of venture into this program and successfully start it.
Of lung transplant is I can compare that કે કોઈ ગાડી જતી હોય અને એને એન્જિન કાઢી લેવાનું અને ગાડી ચલાવવાની, સૌથી પહેલી તો એ જ વાત આવે. એટલે આખું એનું બાયપાસ કરીને સર્જિકલી મેનેજ કરવું ફોર 12 hours, that is very very critical. Second part which comes is infection control. આપણે બોડીમાં ઓલમોસ્ટ હવે બધા જ અંગો પ્રત્યારોપણ થઈ શકે એમ છે બ્રેન સિવાય. હવે લંગ એક જ એવું ઓર્ગન છે કે જે ડાયરેક્ટ હવા સાથે એક્સપોઝ છે. બાકી કિડની ગણીએ, લીવર ગણીએ કે એને ઇન્ફેક્શન કેવી રીતે થાય, બ્લડ સ્ટ્રીમ ઇન્ફેક્શન્સ થઈ શકે. Lung is directly connected with the external environment, so chances of infection in a lung transplant are much higher than any other organ transplants. Hence, infection control protocols and taking care of the patient while the patient is in ICU and ward and in the hospital environment is of utmost importance. And hence, to achieve that level of infection control practices in any hospital is the toughest part. And due to that, there are many very less centers across the country which are able to do lung transplants. Kidney transplants and now liver transplants have been established across the country, but lung transplant, there are very few centers across the country which are able to achieve that pinnacle of infection control.
See, another point why is it so difficult for everyone to do a lung transplant or heart transplant is the clinical infrastructure required in a hospital. So within the last 2 months, we were able to set up an infrastructure worth 5 to 7 CR by creating 2 special OTs for heart and lung transplant, which is separate than all the other OTs, creating 4 bed of transplant ICU which are only designated for heart and lung transplant patients. So to set up that infrastructure within 2 months and spending this amount is not something that everyone can afford, especially when we are a trust hospital and trying to provide service at a very affordable cost. So for us, profits are very secondary. When a hospital is run by a private equity or a venture capital firm, for them the P&L is of the most important aspect for their hospitals. For us, that is secondary. So we were able to take quick decisions and develop the infrastructure in less than 2 months. So apart from clinical aspects, the infrastructure aspects also is something where other hospitals face challenges.